I just wanted to say that part of, I'm a family doctor at heart, and that's what I still do on a part-time basis. But I see that in the digital healthcare space, we need to mirror what happens in real life, which is we need to collaborate with each other. We need to work together in order to accomplish the kind of breakthroughs we want to accomplish for our projects. And we are a natural connector, and we hope to connect to many of the other companies and people that we don't know yet on the call, or the ones we haven't had a chance to work with. And I look forward to the questions from the audience. A little bit about Careteam and the project. We started out with this vision of a person-centered collaboration platform, not patient-centered, but the person, the whole person, not just the entity that has a disease, and understanding how to support them, but also surround them with a team in real life and virtually, and making the healthcare system, which we all know is just a collection of different organizations, actually act as a system around that. When we started out, we had ambitious plans and goals. Where we are today, you'll see that it's a connection between a number of granting agencies, including the Supercluster, and a number of partnerships that we've created that enable us to test some of that vision and idea across diseases as varied as aging, to cancer, to pediatrics, to eating disorders, mental health, addictions, and all of that was done in partnership. So I can't start a presentation without putting together the coalition that we're leading and collaborating with across so many different domains. But for the benefit of those who haven't participated in the Supercluster, I just wanted to give you a sense of what it looked like before we started with the Supercluster project. And so just in the last just over 18 months, I think, we added all of these collaborations and opportunities to prove out that the vision of what we wanted to accomplish works, and also to build it out, but in partnership with others. And so if we were to go into what is Careteam at a core, is we saw us as the connector across the system, as a sort of a health operating system that doesn't just put everything in one place, but figures out what is meaningful for that person today, whether they're a healthcare practitioner, a patient, or a decision maker who needs to understand where are the gaps, where are the overlaps, and how can we make things better. We want to connect the 500,000 different apps, devices, and tools that were invented in the last 10 years so that they can meet the needs of the patients faster. And that's what Careteam does at the core. The actual platform has a number of important features that, of course, table stakes in healthcare have to meet the health and privacy need of the organization, but it's built to connect and integrate, and it's built to enable the individual to understand what is their next best step of action, but also to understand through data whether that step was actually helpful or not helpful, and get the insight as to what works and doesn't work, and create a feedback loop within the system. And so as COVID hit, we had this big idea, the efforts of different organizations around the individual. And so we all saw the predictions in the graph that sort of the different waves of delayed disease and the impact that that would have on the system. But for today, we actually want to walk you through the story of one of our Supercluster projects, the Emergency Case Management Project, through the lens of the organization that actually takes care of the patients. And so I'm going to ask Jeremy to take over and tell you the story of a small organization in Ottawa that rose to the challenge that COVID threw at it, and in partnership with some technology companies did something pretty remarkable. So Jeremy, over to you.
Certainly. I'm just getting used to the slides order. There we go. Right, so as Alexandra was saying, we're working with a group of organizations in the Ottawa Valley, in our capital city region. They're also referred to it as the Champlain Valley. And we've been working with the Dementia Society of Ottawa and Renfrew County and their parent organization, the Regional Geriatric Program of Eastern Ontario, with a focus on dementia and supporting people through dementia, and particularly the caregivers who support them. And then when COVID hit, there were so many organizations jumping in to help, and people were in self-isolation, and particularly the geriatric program was concerned that they weren't able to do their regular geriatric assessments for people that were in the hospital, or the reach outs for people who are in the community. So they identified the two priorities that Alexandra mentioned. One was being able to monitor people who were in self-isolation at home to make sure they weren't deteriorating and were going to end up in the emergency department, and being able to continue to do their support, their assessments, and connect them with the services they needed. And secondly, all these organizations jumping in to help. At the best of times in healthcare and social sports, we don't really have the tools for communication and coordination across them, but particularly in emergency situations such as COVID or an environmental disaster, you've got even more organizations jumping in to help in new and different ways, and they certainly don't have the tools to coordinate and communicate. So this was about getting something into everybody's hands very rapidly, like in one day, that they could use to identify the person, identify everything they needed, and coordinate across them all. So the solution that we developed in collaboration with our partners had the two main components: the remote monitoring and supporting care at home, and then the coordination across the organizations. So I'll share each of these in the demo, but the main components we developed were, one, what we call a smart check-ins feature, so that you can have quick quick check-ins on a daily or weekly basis to see how someone's doing at home, see how they're doing after their surgery, that kind of thing, to make sure that they're not decompensating and end up in hospital. Where they need to do more comprehensive online assessments, such as their geriatric assessment, a COVID assessment, we've integrated our partner Cognizant Ocean Forms, who do full multi-part conditional assessments and forms. And we've integrated our partner CareDove, who do community service requests. So you can link directly out and get access to all of the services in the community that you need, and make sure everyone's on the same page. And then coordinating across organizations, we already had the ability in Careteam to build the team, but we expanded the ability to flexibly invite other healthcare providers who weren't already on the platform, sort of the viral spread, to get it out as rapidly as possible, and be able to invite caregivers to sign up to help their loved one, even if their loved one themselves was not able. We also expanded the functionality around supporting integrated care plans across organizations, so all of these organizations could collaborate together. And we did the integration with AlayaCare, who's the preeminent provider of solutions in the home care and community market space, because they have a large part of the puzzle of all of the home care, community support agencies, and so on, who are providing the supports in the community. So now we're able to bring together a complete picture of what's happening for the person. So the Regional Geriatric Program of Eastern Ontario covers quite a wide geography of both large urban centre with the tertiary, quaternary hospitals, the Ottawa Hospital, Queensway, Carleton, all the way out to the very small community and rural organizations with limited internet connectivity. So an interesting group. Substantial size, 84,000 seniors, about 40 organizations involved who've all been adopting the platform, and over 150,000 caregivers. So a lot of people touched. And so we brought together, with the support of the Supercluster, both the partnering organizations that are implementing the platform, the geriatric program with all of its members, and the Dementia Society being one of the most proactive, and then our technology partners with CareDove, Ocean, and AlayaCare. So the core part of the platform that we started with is the ability to wrap the support around the individual, identify the team that's involved in the person's care, establish a care plan for that person so everyone knows what needs to get done, and then that care plan contains all of those activities, the appointments they need to look after, the tasks they need to do. We introduced our new Smart Check-ins feature, and then we wrap around that messaging component so everybody can stay in touch, whether it's Red Cross doing door knocking service, the family doctor trying to follow up with the person, and the Regional Geriatric Program nurse doing follow-ups. So all of those people can stay connected across their different organizations. So the core part of the platform that already existed was the ability to pull together action plans from all of the different organizations in the community. So not just one organization adopting Careteam, but an entire community of organizations can each adopt Careteam and collaborate across in a very person-centered manner. The person can then invite their support team, get everybody involved, whether it's after a discharge or during COVID, they want to invite their community pharmacist, their physiotherapist, their home social worker to engage in their care. The messaging feature to communicate across them. and then the ability for the healthcare team to engage in the platform and build their protocols to support the person without needing to understand anything about the technology. All of this has enabled us to roll the platform out within a day. So we can engage with the customer, have them up and running, and inviting their first patients within 24 hours. Without further ado, I'm just going to give you a flavor of a couple of the key components that we built out as part of this project. The things that you just saw were the things that already existed. When you log in as a clinician, in this case it's Dr. Alice Jenkins, working at Memorial Hospital, she sees her person list. When she looks at a particular person, Jean Aitchison, older lady, she sees all of the activities that are going on in Jean's plan, regardless of where they come from. You can see that she's had a referral out for community services through CareDog, so everybody's on the same page. There's no telephone tag, faxes, etc. You can see that there's been a community service request. You can see that that one's pending. When it gets booked, it shows up in her schedule. You can see the things that she needs to look after. And you can see that her family members have signed up to look after these. Her son's looking after this one. Her husband's been asked to look after this one, but hasn't confirmed yet. And then you can see that she's been asked to complete a pain scale, a caregiver stress index. And then as I realize as a clinician that she needs follow-up care, I can go through and trigger a referral through CareDove to trigger a referral to community services. So I just go here and add another community service, and it launches a CareDove platform, and I can go through and identify which kind of community service she needs, whether it's Meals on Wheels, community activities, anything, and I can go online and fully book it. So I can choose the date, time, etc. And when I do that, it comes right back into our platform so everybody can see what's going on. Importantly, I can then expand the team because in an emergency situation, there's so many different people that are involved in supporting the person. So I can choose to add other team members, be it if it's an elderly person, I can invite their adult child or their spouse to join the team, or I can invite, say, her family physician or her home social worker. And then they can all collaborate on this plan and be able to communicate amongst themselves. And then lastly, on the healthcare provider side, we wrap around the secure messaging. So if you're planning a discharge, or in the case of COVID, we've got, say, a Red Cross door knocking person, realizing that the person is needing more support, can connect out to the social worker, line things up, update the family doctor, and say the adult child. Keep everybody on the same page. I'm just going to switch over and log in as the patient.
I can see Annika is saying that we're going to be running short on time. So while you log in, Jeremy, the fun thing and the key outcomes of this is just watching organizations save so much time and effort, but also loop in family members during COVID, who even when they are located in the same city, they couldn't sometimes visit because they were healthcare workers or they had children or the risk was too high. Just be on the same page and reassured about this and seeing what's going on in their loved one's care. Back to you.
Absolutely. So just the last couple of things. I mentioned the check-ins. So our customers have used these in a number of different ways. Here's an example of a pain check-in. They're using this to check in on the person on a daily basis during COVID, see how they're doing, see if they need additional support. I mentioned that they can't currently do they're also doing caregiver stress indexes because a lot of the challenge during COVID has not just been the person themselves, but all the people trying to care for them who themselves are dealing with issues around work and health and so on. And then I mentioned they can't do their in-person assessments anymore, so they've moved their assessments online. So here's an example of our integration out to Cognizant Forms. So we're able to replicate what they would have done previously in person with an in-person assessment, and they're doing it online now entirely through an online form. My internet connection, unfortunately, is a little bit slow. There we go. So all of that information comes back in the care team. So everything's in one place. Everybody can see what's going on for the person. So just to wrap up, the project has gone really well. The outcomes within the community are that they now have a standard of care that's across the network. They now consider use of Careteam and the protocols that they've established as their standard of care. they're sharing care plans across the community. So for the first time ever, we're seeing like a social worker at the Ottawa Hospital creating a discharge care plan, inviting the family doctor, the Dementia Society, the social worker to join that care plan and having a smooth handoff. All of the healthcare providers have onboarded onto the platform, and we've seen a remarkable 76% of patients and caregivers activating their care plans and participating. And the integrations with our partners are all working really well. From an outcomes perspective, the community agencies have been enabled to support the people during COVID really remarkably well, despite the challenges of self-isolation. They've achieved the transitions from hospital to community, and our Ottawa customer group have become self-sufficient in supporting the rollout in their community, which was a really key thing. One of the pieces of the funding through the Supercluster COVID project was not just the technology, but also supporting the change management component. So they had resources to facilitate the adoption, and they have that component. And now, as they look forward to the fall, we're all seeing a little bit of a respite, but they expect that there's going to be some kind of a fourth wave and potential other issues. And so they now have the community engaged and the ability to connect them on the platform and continue to support them. As far as spread, the Ottawa group have been fantastic as a customer group. They're also helping us with our other customers with their adoption and acting as references for prospects. A lot of the functionality we developed for this project has already been reused in other projects. So the smart check-ins, the online forms are being used in our TrustSphere project, our perioperative quality improvement opioid reduction project, both of which are Supercluster supported. And I'm very pleased to say that we've secured a substantial national project, which is very much on the heels of this project and leveraging everything that we built with this project. And lastly, our next steps, the Ottawa group is continuing to expand their adoption based on what they did with this project and moving beyond COVID and continuing to support seniors in the community in a more holistic way. And they're now expanding into the new shift towards Ontario health teams, both in Ottawa and in the province as a whole. So that's a big focus for them and for us from a business perspective. Us and our partners in this project have the same kind of growth plans, both in Canada, but particularly also the States. So that's a big area of focus for all of us over the next year. And we're building out our integrations. So I've mentioned the integrations to CareDev, Ocean, and AlayaCare as part of this project, and a big area of our next steps is integration with other platforms. And that's Careteam.
Well, thank you so much, Jeremy, Alexandra. Fantastic presentation and really exciting to see a truly integrative approach to the care for seniors and other patients at the center of all this. So while we open it up for the community and the participants here to ask questions, maybe I can start with a couple that came to mind as you went through that. Maybe we can just take down your screen for a minute there, Jeremy, and we can return back to all the faces there. So now that you've kind of been able to demonstrate the success in the Ottawa Capital Region, probably learned a lot, bringing lots of partners together, what would be the types of partners or customers that you're seeking to work with going forward?
Certainly. We refer to the expression health ecosystems. As Alexandra said at the beginning, we often say health systems, but they don't really act as systems a lot. So a key target for us is health ecosystems, be it local communities. The Ontario example is perfect, the Ontario health teams, where they are trying to provide more integrated person-centered care across disparate organizations. So all of these disparate organizations each have their own electronic medical records and separate systems, and they need this team-based collaboration platform to connect across them.
Yeah, one of our users said that all her professional life, she's been encouraged to practice multidisciplinary care, but never given the tools to do that. And she's like, I can't believe that this has actually happened. And so primary care networks, complex provincial programs, that's why we're working with BC Children's. Like, how do you make that vision of one organization being the hub of a series of smaller organizations that are distributed? And how do you address the disparity that people living in smaller centers need to wait for services that people in bigger centers can have access to? And so our partnership on wish list has technology companies that Elements, that almost like the specialist equivalent to our GP on the digital world, but also organizations like Providence Health, BC Children's, BC Cancer, who have that lens of being
recording in
just,
progress.
what they deliver.
That's great. And so I imagine in addition to the technology innovation you've done, there's a fair bit of business model innovation to try to pull this all together. What can you share with us in terms of what has had to adapt from a system perspective, or how customers or partners are sort of seeing how they either benefit or contribute to a new business model?
It's a great question, because in healthcare, there's often not a budget line. I remember when websites were introduced and people were like, we used to communicate through flyers to your community, and then what's my budget for a website? How do I get the funding? And foundations played a key role in being supporters, but also changing reducing the risk or the perceived risk. And so one of our strategies was to introduce a flat, no surprise fee. And so everyone was encouraged to add as many people without being afraid of getting a bill that said, hey, you've just added 40 new organizations or individuals, and therefore you're now paying X% more than what you were doing before. And so that no surprise environment and reassurance that you could really share this with everybody was really key. Until then, case management was reserved to a human estimating which one of those 84,000 patients are the most problematic, and sending a human to find out if that's true. But we're not very good at predicting who needs help. And so that ability to say everyone's welcome to self-serve through the tool and the platform and the connection to the network, but the ones who need help, we can quickly identify and add more resources to them, and all for the same price.
Okay, terrific. Let me open it up and see if anyone in the community has any follow-on questions for you folks. Okay, doesn't look that way, but we'll return back in case people have questions at the end. So now it's my pleasure to introduce Ariel, who is going to provide a demonstration of the Workplace Brain Health Project. Ariel, over to you.
Thank you. Hello, it's a joy and an honor to be here. Let me just bring up my slides. All right. Ta-da. Hello, my name is Ariel Garten, and I'm representing the Workplace Brain Health Platform. We all know we're in the midst of a mental health crisis with high human and economic cost to it. Even prior to the pandemic, over 50% of people suffered from at least one mental disorder at some point in their lifetime. In Canada, mental health issues make up 30% of disability claims and an estimated $20 billion in work-related losses. We just heard about the effects that difficult health has on our healthcare systems. Well, here we are trying to look for a solution to implement into our employee and employer arenas. We see that poor mental health in employment status has been correlated with severe performance deficits and challenges with inhibitory control, self-regulation, emotional reactivity, focus, and other essential cognitive capacities. And when we look at the health and safety of our employees and population, we see that these can pose a significant risk, especially to those employees who are in high-risk, high-liability jobs, which is actually 1/3 of our Canadian workforce. When we look into the past, we see that COVID has had a significant impact in our mental health, and it's been quite traumatizing. So when we look at the period of January to July of 2019, we see about 1 in 10 people saying that they had mental health difficulties during that time. When we look just at January 2021, we see 1 in 4 people had mental health difficulties, anxiety, depression, etc., which is a staggering increase. On top of that, we have a society that has incredibly poor sleep. So poor sleep has affected 1/3 of Canadians who report trouble falling asleep or staying asleep at night. They have difficulty staying awake during the day. 30 to 50% of people have chronic insomnia, and this is over a $400 billion impact just in the US alone. And there's a high correlation between people with poor sleep and mental health. And people with severe insomnia are even more likely to have work-related accidents. So all of this brings us together to create an intervention with a series of partners for workplace brain health. We came together as the Workplace Brain Health Platform team, together with Hatch, who is a large engineering firm who is really focused on the health and safety of their employees. Ourselves, Interaxon Muse, whose goal is to create a device that improves brain health through meditation and sleep. Cambridge Brain Sciences, and Cambridge Brain Sciences creates a validated assessment of cognitive health that's used widely in both healthcare as well as industrial arenas. And Western University came on board to help us validate the tool that we've created. And what we're creating is the Workplace Brain Health Platform that provides employees with a resource to help employers improve their cognitive performance, their sleep, and their mental well-being via brain sensing EEG technology, guided meditation, and sleep monitoring and assistant programs, as well as cognitive and behavioral assessments. So essentially, we've seen the impact that the pandemic can have and the impact that mental health and poor sleep can have, and we're here to generate a solution to help improve these. When we look specifically at the arena of meditation, what we notice is that meditation has been demonstrated to have significant impacts on all measures of mental health: sleep, anxiety, depression, resilience, and more. Meditation has been demonstrated in the literature to even improve the actual physical structure of the brain. However, meditation is rarely successfully implemented in corporate programs, and people don't usually keep their meditation practice long-term because it's frankly hard to start or maintain a meditation practice. We desire to solve that problem by creating the device and the platform. So this is Muse, the brain sensing headband that helps you meditate and sleep. It is a clinical grade EEG with EEG sensors on the forehead and behind the ears, as well as PPG sensors, accelerometer, and more. What Muse does, it gives you real-time feedback on your brain during meditation to help you start or enhance your meditation practice. Now, most people, when we ask them why they're unable to start or maintain their practice, it's generally because meditation is kind of intangible. There's no data, there's no feedback. You sit there trying to meditate and your brain's kind of bouncing all over the place, and there's no little coach inside your head telling you what to do or if you're doing it right. So most people feel like they're failing and find it hard to stick with the practice. With Muse, we solve that problem by actually giving you real-time feedback on your brain during meditation, so you can hear what's going on in your mind during your meditation practice using the EEG, PPG, and other sensors. And then at the end of your practice, you get data, charts, graph scores, things that actually show you what your brain, heart, breath, and body were doing during the course of your practice. Muse has interventions for meditation during the day, and with its suite of clinical grade sensors, also has interventions to help you sleep at night. So Muse has go to sleep interventions that are designed to help you fall asleep faster. And then since it has clinical grade EEG and other sensors, can actually track your sleep through the night essentially as effectively as a sleep lab. And so the Muse knows during the night when you're waking up because it's tracking your sleep, and then can provide the same intervention that helped you fall asleep, automatically bring it in to help you fall back to sleep. This has been demonstrated to be extremely effective, and we're essentially calling it our digital sleeping pill. What we did was we came together as a consortium to create a platform and an intervention using the Muse, either as a meditation tool or as a sleep study. We created a 6-week intervention in a study that was crafted by Dr. Adrian Owen. And we deployed this with the community of Hatch participants. We had 300 volunteers to the study, and 130 of them were put into the meditation study, and the other 130 were put into a sleep study. In the meditation study, we had 3 groups: one the control, the second who were meditating on their own with no human coaching, just with the Muse, with a 1-hour onboarding, and then they went off on their own. And then a third group who got the onboarding, and then they had human coaching every single week. In the sleep study, we had a control group, a group who was doing Muse on its own without a human, another group who's doing Muse plus digital sleep hygiene, and then a third group who's doing Muse, digital sleep hygiene plus coaching intervention. So we had multiple layers of the study in order to see what was really required to see the kinds of benefits that one typically can see with a meditation and sleep improvement intervention. The study was a 6-week-long active period. So people were told to meditate and use Muse for 1 hour, meditate and use Muse each day for 6 weeks at a minimum 5 times per week. At the end of 6 weeks, they were told, do whatever you like. The official part of the study is over. The Muse is yours to keep. And we simply sat back and observed them for another 6 weeks. In addition, we put in a large battery of assessments created by Cambridge Brain Science. So Cambridge Brain Science has a validated battery of cognitive assessments looking at multiple dimensions of cognitive function. In addition, we looked at people's sleep, anxiety and depression, quality of life, workplace wellness, and other measures. Dr. Adrian Owen's lab is right at the beginning of analyzing the data because the meditation study just completed and the sleep study is actually in its 9th week, so it's not complete, but we are able to give you some sneak peek results. When we look at the meditation data, what we see is something quite great, which is that you actually can implement a digital meditation solution that keeps people meditating time and time again. So on the axis here, you see the average number of sessions per week. And along the bottom axis, you see the number of weeks. So in week 1, people are told to meditate every day, so 7 days a week, 7 times a week, with a minimum of 5 times per week. We understand that not everybody can do it every day. What we're seeing in week 1 is on average, and this represents 100 people. The blue line are the people who did not have any coaching. They're just given a Muse to use on their own. And the yellow line is people who had coaching. They're meeting with a real human once a week. Whether they had a human or not, week 1, everybody's super excited. They do on average almost 2 sessions of meditation per day. By week 5, they're kind of averaging out and they're still maintaining their once per week. By week 6, end of the study, people are still doing 6 to 7 meditations each week, just about every day. And then we tell them the study's over. And look what they do on their own. They continue to meditate with Muse, and at 3 months out from the beginning of the study, at 12 weeks, people are using it on average 5 times per week. And they're doing this whether they had a human to teach them what to do or to support them and hold their hand along the way or not, with simply a digital intervention. So if any of you have ever tried to bring a meditation intervention into your corporate environment, you know how difficult it is. You have very limited sign up, you have a lot of drop off very quickly, and people might be meeting with their teacher once a week and probably not really meditating in between. And what we've seen here is incredible adherence and benefits. When we look at the sleep data, and we're still in mid-process, we're looking here at the amount of people's sleep scores. Here at the beginning of the study, we see an average sleep score of about 62. And here in week 9 of the study, we're seeing an average sleep score of just over 70. So almost a 10% improvement in sleep over the course of the intervention. I'm going to take a moment and actually share some of the quotes from the participants because it's quite awe-inspiring to hear. So these are individuals who were simply in the course of the study were asked for some feedback without being prompted that this was a testimonial or anything. This is just their unprompted communications about the device and their experience. And most of these are week 5 to 6.
I'm quieter, for sure. Well, I've never been a really active, but I'm quieter, and I manage my emotions better, I think. So yes, it's good for me, I think. Yeah, really.
And this is later.
Yeah, I'm more able to tell myself, okay, just keep quiet, let's say that something is arriving in an email. I'm not happy with that, you know.
Mhm.
So a new task to do on top of the others and say, okay, just, you've read the email. It's okay. You know, this has to be done. Don't rush. Just wait. Think about it and how you can maybe do it, or maybe you can speak with the person to just, you know, work around this new task and see how you can manage it, or maybe just tell the person that you cannot, you know, and explain why, rather than just feeling angry and I don't know how to say this in English, but in your mind, I'm not happy, and I won't do that, and just keep quiet.
So that was, you know, a subtler response.
I think it's getting easier, and during the day I do feel a lot more that I get to check in with myself more, with my breath. I can feel it when I'm irritated, instead of acting on it or just be like, oh, I won't be productive right now anyways because I'm irritated on something that I don't know. Instead, I can actually calm my breath to see whether this irritation is coming from boredom or coming from some, I don't know, work email, some work items, or just something else in life in general. And that really helps to diagnose, just looking at my irritation in a more calm way, and kind of bring my attention back. Oh, well, I kind of feel bad about something earlier, but that's okay. I can just breathe it out. I know what's happened. I don't have to let this irritation to guide the rest of my day. That actually happened quite a bit lately. Whenever my attention shifts, or I don't want to do work, for example, or I really don't want to do this one thing, but I can actually know, going back to asking myself why I don't want to do this, or what's preventing me from doing what I need to do at the moment, and kind of just set up some rules, like I'll just keep my focus for this 20 minutes and I'll take a break and then keep going at it again, and breaths really help with.
So here's another participant. So, you know, some of these effects might seem subtle, but the difference from somebody who is, I was in some of these sessions listening, and the people be like, I used to be really frustrated and angry, and now I'm able to observe myself and not have these reactions.
I've been calmer. And it has been like a daily routine now that, oh, I have to do it, but like I want to do it, the meditation, and it kind of takes me to another different place or dimension that I feel calm and I get recharged for the next day. So yeah, I've been calmer. I cannot even remember any moment of stress, or maybe even a thought would come. I would just be like, okay, let's just breathe here, because we are not breathing, we're breathing very shallow.
So those were all questions, responses in reaction to what has life been like since you've been using it during these 6 weeks. That's in the meditation study. Here's some reactions from the sleep study.
For me, for sure, is the going to sleep sessions with the ambient sound. That I will probably keep maybe forever. It helped me fall asleep quite fast, and I'm not wakening in night, almost never. And if I do, I just go back to sleep easier with concentrating on my breath. And even if I go to the bathroom in the middle of the night, I just come back and fall asleep instantly, I think.
Amazing. So, and is that different?
That's a revolution.
Is that different than it was before?
Absolutely. I could wake up 3 or 4 times a night before the study began. And I was very skeptical at the beginning, but I must say that it's just working. So.
And here's just the last individual. There literally dozens.
It's definitely been really life-changing, I would say. And now with that information, I would carry it to, the next, pretty much all my life, I think, now that I have that information. So, thank you, for taking me on this journey. And it's definitely been an amazing experience using Muse and seeing how my life has changed,
This individual goes on and on and on in the various ways that his life has changed. And this is actually,
Ariel, we're just running a bit short on time.
No problem. I'm good. I'm going to keep going. So those are in addition to the impact that we've had, that was the last quote, so perfect. In addition to the impact that we've had in people's lives, we also gathered an unprecedented amount of data. In 12 weeks of people using Muse at home, we gathered 946 hours of EEG data, not sleep, plus PPG and movement, and over 17,000 hours of sleep data. So this is structured sleep data, including EEG, PPG, movement, and others. So we're keen to have research and other partners mine this data to have new insights into the brain and brain health. The next phase of our project is the commercialization based on the positive findings that we've had and the impact that we've been able to have on the participants. We're excited to begin rolling out the workplace brain health platform and move to the next phases of commercialization with it. We're actively seeking additional corporate clients who'd like to bring the benefits of meditation and workplace brain health into their organizations. So we're offering the 6-week meditation and sleep program to both corporate as well as healthcare organizations. So in terms of a call to action, would your organization value their workplace employee well-being? Do you have teams who'd be interested in a 6-week intervention to help improve their sleep and their mental well-being and be able to handle life's challenges more effectively? If so, please reach out and we'll share a contact on the next slide. We're also interested in partnering with healthcare or insurance companies that can help us deploy this more broadly. And on the data side, we're looking for partners in pharma research and healthcare who are interested in finding insights from the data that this kind of platform can continue to generate, as well as any pharma, healthcare, or research providers who are interested in adding low-cost EEG or sleep tracking into future studies. So if you have any partnership inquiries, please reach out to Sam Kerr. And here's the contact of each of the consortium members as well if you have any additional questions. Thank you.
Great. Thanks so much, Ariel. Great presentation. We have a few questions on the chat. We have a few minutes to put them up. So I think Alexandra had one as to whether Cambridge is approved for use in the US.
Sam, do you know the answer to that? So I'm not from Cambridge Brain Science, so I don't know the specific answer to that. Actually, they probably are because we are participating in a study together at the Mayo Clinic and CBS is being used there. You can reach out to Alex Sherrington with that direct question as well.
Okay, we have a question from Mark Peltier. Are there plans to publish your study and do you have institutional customers, health authorities, sleep labs?
Great. So the study, after Dr. Adrianone finishes analyzing all the data, and there's a rich trove of data to analyze, we anticipate it being published in a strong journal. Adrian has a great record of publications. And in terms of institutional partners, so we've applied Muse to a number of different healthcare verticals, and we have institutional partners doing some validation, like Mayo, I just mentioned, is now doing, I think, 4 studies with Muse on the back of one that they published using Muse for breast cancer patients. And we're extremely keen to find additional institutional and corporate partners to bring this specific program to, since we've been able to demonstrate such a tangible benefit in people's sleep and well-being. Okay. So if you're interested, please reach out.
And there's a question from Christopher Sutton. Did you define your own sleep score? Are there existing metrics? And is this seen as a medical device?
Sure. So the sleep score that was used here is a combination of sleep latency, sleep efficiency, length of sleep, as then adjusted based on age and gender. There's also within the study PSQ, so a Pittsburgh Sleep Quality Index, and that data is yet to be analyzed. This data was easy to analyze, so we had it to be able to present now. The PSQ will be presented at a later date.
Okay,
and then of being a medical device, we're not a wellness medical device. We're in the general wellness category, but we are walking down the path of becoming a medical device and anticipate having a medical device version of Muse within the year.
Okay, so that's a good bridge to the last set of questions. Is it covered under existing health plans? Or will people need to purchase it separately?
It's not covered under existing health plans, though many health plans do have flex dollars. So an employer, if you're self-insured, this might be an opportunity to work with your insurer because this is something that could actually decrease their costs moving forward. So we're keen to speak to more insurers to understand the economics of it and to give very reasonable rates to employers as the consortium partners in order to help us deploy it more broadly.